Okay, so our final speaker today is LJ Bird, and LJ has been working with Partnership Health Center, and the title of his presentation is Meaningful Community Participation in Health Services Development and Evaluation. And Amy Kierzek is the Program Development Manager at Partnership Health Center and was his site mentor. So thank you, LJ, and take it away.
Okay, nisto ni tani ko pito suwates. Nitong tu misen kisit ta ni sista anasta kaki kinana anasta kamil kitopi. Hello everyone, I welcome you all into who I am. My name is Bito Suwates. In English, you can call me Leo John or LJ Bird. I am a senior community health specialist of anti-racism and equity at Partnership Health Center. My site mentor is Amy Kierzek, one of our program managers in the innovations department here. And as Lee stated, my project is meaningful community participation in health services development and evaluation. So to provide a little bit of a background of the patient populations we're going to be discussing is our Indigenous and transgender, non-binary, and two-spirit patients here at Partnership. For those who are unaware, Partnership Health Center is Missoula County's community health center that serves about 16,000 unique patients annually. And so there was a COVID-19 vaccine access and equity grant that Partnership Health Center was able to acquire that wanted to address uptake and access for Black, Brown, Indigenous, and people of color and other systematically excluded populations with regard to the COVID-19 vaccine. And some early conversations that were had even before I was hired there was talking about the Indigenous patient population and the relatively low vaccination rates that we're seeing here as compared to on-reservation rates. So for example, at Blackfeet Nation, where I'm from, we were at like 89 to 90% vaccinated at the end of 2022. And the numbers at Partnership Health Center were a lot lower, like around 26, 27%. And so very fortuitously, there was an opportunity to reach out to Native patients and folks that utilize Partnership Health Center services. And this was at the Montana Two-Spirit Gathering that is held each summer in Lake County. At this event, I was able to ask questions of why Native patients that were using Partnership Health Center services were not being vaccinated. And in some of these conversations, I learned that there was more to be learned from this community, as well as I learned about specific inequities that were occurring within the Two-Spirit, non-binary, and transgender community pretty uniquely, and that have been happening all of their lives in various healthcare settings, not just Partnership. And so these conversations started to happen, and we started to get excited to create expert advisory councils. And the idea of which is to get 8 to 12 patients that come from these layered intersectional identities that represent transgender, non-binary, two-spirit, and Indigenous existence, and how they are navigating Partnership Health Center, as well as thinking about health and wellness more broadly. We created the Transgender Patient Advisory Group and the Native American Health Equity Council. These groups, we had monthly sort of focus group style meetings, as well as culminating in one-on-one interviews that I transcribed and kind of created a thematic analysis of, to get a better idea of what was happening in these patient populations, and to come up with 2 or 3 ways that Partnership Health Center could do better in their healthcare administration and services. There was an entire recruitment process for getting patients involved with these groups, including creating informational postcards, having provider and staff referrals where they could use our e-clinical work to refer patients directly to me so that I could get them involved in the group, as well as doing a convenient sample via social media of patients who I personally knew or that I had some sort of contact with, just given my own lived reality as a queer and Native individual. After the monthly meetings held via Zoom, most of the one-on-one interviews were done at the end of that, but really they were available to the patients from the beginning as well. We kept patient identities confidential in notes and presentations because anonymity was a really important dynamic that was suggested by patients in both groups from our very first meeting. Early conversations about reciprocity and community engagement led us to create an honoraria policy here at Partnership Health Center, where we understood that it was important to, if we were going to be asking from this information and from these stories of some patient experience, that we had to provide something back. And so we were able to compensate all of the patients for their time each time that they met with us with the advisory boards, as well as during the one-on-one interviews. Just a note that all of the findings are going to be presented to our executive leadership team and to Partnership Health Center's Justice, Equity, Diversity, and Inclusion Committee. I wanted to share a couple of patient quotes that really get at the importance of some of this qualitative work, that because it really will inform us moving forward, and it really already has started to initiate conversations about change and about advocating for better equitable healthcare. So a first quote is provided by a member of the Native American Health Equity Council, and it states that I really wish that they had a patient advocate, because I really think that they need communication between the patients and the staff, so that maybe the staff and management codes begin to see some things that they could improve on and actually listen to the patients. Another thing I would like to see is patients can be heard as people, because there is an air of condescension. So what happens is everywhere you go, because we are Indians, nobody ever listens. Nobody ever asks any questions. I'm just feeling that people are treated like they're not people and they have no value, and they're seeing people as meaningless because they're not important. So I wish that Partnership had some kind of mechanism or real dialogue and real communication and not just pretending. I think that this quote really speaks to the dynamic that we were able to create a trusting environment in our groups and in our one-on-one conversations, so that this patient felt that they could really speak their truth. And I also want to highlight that as the world is starting to have more conversations about justice, equity, diversity, and inclusion, that it's time to start really putting these into action, and not just kind of having a cosmetic answer to what that would mean. And then to kind of provide a more hopeful note of what was able to come out of the group, was a patient was asking, I asked the patient in the transgender patient advisor group to respond to a question addressing changes at PHC that were of their highest priority. And this patient said, when I have those small moments where I feel like I am finally going to be heard and it is a safe place and it wants my involvement in my own healthcare, that I can begin advocating for myself and begin down a path that can lead towards major medical well-being, whether that means through having quality of life, through transition, or in my case, and in the case of many others, it has saved lives and brought people back from deep, deep, dark depression. And it's just these small things that let us into society and into this space in a way that we want to continue reaching out. I really appreciated the passion and the power of this message of feeling the ability to speak in a trusted space, as well as being able to advocate for themselves as we as Partnership Health Center start to say, hey, we recognize you and your patient experience as being pretty unique, and that sometimes Western biomedicine in our clinical settings don't they weren't necessarily built with you in mind. And we want to include your voices in ways that we can begin to do better. And so that you can also advocate from yourselves and kind of maintain this agency. So I really appreciated this kind of moment that we were able to have within the interview. And I think it's important when we listen to it to keep moving forward. I wanted to briefly mention some of the core competencies that we worked on. Quantitative and qualitative review, creating these thematic analyses, looking at some of our electronic medical record data, and kind of contextualizing this qualitative work to this quantitative work that we already have here at Partnership Health Center. As stated with cultural values and practices earlier, I have lived academic and professional experience working with both populations. And I think it's something that I don't want to kind of underscore, and I want to highlight is that I think part of the reason why there was this trusted space that was created is because I am somebody who identifies with both of these groups in very real ways. And so moving forward, for other patient advisor groups, if we can bring people in who are able to ask questions and facilitate who do come from these identities, I think is important. Made community connections at the Montana's Two-Spirit event. Also invited a MSU professor who was a expert in her field in transgender care. And then also talking to Transvisible Montana and All Nations Health Center. The data interpretation, I think, is something that I've already spoken a lot about. But in the interest of time, kind of talking about advocating for political, social, and economic policies, again, referring back to the honoraria policy earlier, as well as the policies that I'm already starting to look at moving forward, like how to maintain a health equity lens in everything that we do in various aspects of Partnership Health Center. And so finally, I just wanted to talk about what this looks like for us moving forward. So tomorrow, I'll be giving a presentation to our executive leadership team that includes these 2 to 3 cogent recommendations for changes and how to do better by these patient populations, as well as more of the findings from the thematic analysis of the one-on-one interviews. I myself have started a PhD program in Indigenous Studies at the University of Alaska Fairbanks, and I have an idea for a dissertation to be language revitalization and education and its intersections, and how that might be able to help address some of the epidemics of substance abuse disorder that we are seeing in some of our tribal communities. And incidentally, I've also applied to law school, and we'll hopefully hear back soon as a potential trajectory that I didn't expect going in, and have now been excited to do that. So I really hope I can be in the Alexander Blewett School of Law. And I just wanted to give a special thank you to Dr. Annie Belcourt and Dr. Tricia Miller for supporting me along the way. I really appreciate all of the feedback and letters of recommendation and just help and love and support. It has been a strenuous journey, and I feel very thankful and gracious to be at this point. So at this point, I'll stop sharing my screen and open myself up for any questions that folks might have about this process.
Thanks, LJ. Great job. You made it here. So does anybody have any questions for LJ? Oops. Oh, maybe Blakely.
Yeah, hi. Hey, LJ, great presentation. Good to see you. Woohoo. All right. Just kind of my big question, I guess, is just, and maybe you said this, so I apologize if I missed it, but just action steps going forward at partnerships in terms of applying what you found out to actual action there.
Yeah, so basically at tomorrow's presentation, it will be a little bit more in depth of what this process looks like. So we created these expert advisory councils as a way to kind of understand patient experience and to be able to kind of engage in some power sharing with our patient population. And so we want to get an idea of whether or not that worked in this case, or what needs to be refined, or what we might need to change moving forward, as well as kind of taking, I think most folks in our executive leadership are pretty well aware of the quantitative data that exists, or how well we are able to meet certain measures in these communities, at least specifically with the Indigenous population. But I think this qualitative piece, this component, hearing patient stories are really gonna help help highlight of what we could do differently, because both populations in their own way are thinking and conceptualizing about healthcare and wellness in different ways. And I think as a health center, we get really into biomedicine. We get really into Western Eurocentric ideals of what health and wellness means. And for both these populations, I think that there is a different component. For the Indigenous population, there's this deep cultural and spiritual sense that I think gets missed out in a lot of conversations. And for our transgender, non-binary, and two-spirit patients, there's this reality of safety that I think gets kind of glossed over, and puts patients in harmful situations because of it. And so we want to address those. As far as kind of like some little things that we're going to advocate for, is to bring out more of our policy work to reflect sort of these lessons learned. So there's this equity component of we know that there are other patient populations, subpopulations that exist here. We have a large refugee population. There's quite a few patients who are using our medical assisted therapy program. What can we learn from these patient populations, as we know that there are also inequities there? Is it best for us to do an expert advisory council? Is it are there limitations there via Zoom? Like if we were doing our unhoused population, are we going to be able to bring in Zoom conversations, or do we need to go back into in-person? And sort of questions like that. I think for the most part, there are short-term and long-term goals that came out of these interviews. And so for the short term, I think that a lot of things can happen pretty immediately, like within the next, few months. But during our interviews, we also asked the question of what would you like to see happen in 5 years? So maybe, 5, 6, 7 years down the road, we might be able to see some of those shifts as well.
Thanks so much.
Thanks, LJ. There is a question here in the chat from Meg Tracy, and I can read it for you. Excellent presentation. Thank you. People who are multiply marginalized are overrepresented in institutional settings where COVID-19 has been so difficult to control. Examples, prisons, nursing homes, and large congregate care settings. Were there partnerships you developed that helped public health bridge more effectively to support institutionalized people? And maybe just a comment or two. We're pretty close to our time, but just, I don't want to miss this question.
Yeah, I don't think specifically we were working with any folks that were institutionalized in that way. I see what you're saying though, Meg. I think that what you highlighted is another couple of populations that there are deep inequities with. And so the partnerships that we made, I think, are with community organizations outside of Partnership Health Center that are also healthcare oriented, that are introduced in the work that we are doing, to be able to kind of replicate that for themselves. So what I imagine is if we highlight this experience and lessons learned and moving forward and whatever, with our expert advisory board councils, that maybe some of the social services or healthcare programs in Missoula and in the county broadly that specifically work with institutionalized populations would be able to convene that for themselves and hopefully glean some of the lessons that we learned in our experience. So I think that moving forward, if there are organizations that specifically work with these populations who we also serve, or who there might be some overlap there, I think we could totally work together. At the same time, I also would suggest that they reach out and say, hey, we are also interested in this work. What were some things that you learned?
Great, thanks. All right. I think we're at about our time. I will say a big congratulations to all of you who have presented today. Yay! Lots of hard work, and I want to thank all the site mentors for being there for our students, and we really appreciate the relationships and the support of the School of Public Health. So without any further ado, I want to say thank you to everybody for coming today, and have a great afternoon, and congratulations, everyone. Have a great day. Thanks.